Right. Thank you so much to everybody for joining me today. My name is Jenny Stark, and I am a Medicare sales executive with Regents Blue Cross Blue Shield. Tina Davis will be joining us shortly. She is the Utah State University Medicare Retirement Specialist, and she will be helping you all with your questions and any future questions that come up with these new plans that we will be presenting today. The webinar is being recorded. After we're done today, I will email everybody out a copy of this recording and then also a copy of the PDF presentation and a digital enrollment packet. If you have questions throughout the presentation, please type them into the chat or Q&A box, and I and Tina will both keep an eye on that and make sure that all of your questions are answered. And we will go ahead and get started. I am presenting a Medicare 101, and then I will, the last half of the presentation, present something very exciting to you all. It's the Utah State University's Regents Medicare Retiree Group Plan that is newly offered and available to retirees and their spouses after January 1st of 2022. All right, we will get started. In this presentation, I will talk about Original Medicare, just briefly go through a Medicare 101 and how Medicare works, and then how you can enroll in Medicare, and then we will end the presentation with Utah State University's Regents Medicare Retiree Group Plan benefits. Original Medicare is health insurance that's administered through the federal government, and it is designed for people who are 65 and older, people who have also been citizens of the United States or a permanent resident for 5 consecutive years. And then people who are under 65 can actually qualify if you have Social Security disability income for 24 consecutive months, or have end-stage renal disease, which is kidney failure, or ALS, that is Lou Gehrig's disease. Original Medicare has 2 parts. There's Medicare Part A, which is hospital. Medicare Part B is medical, which includes things like doctor's visits, outpatient surgery, and so forth. Both Medicare Part A and Part B are administered through the federal government. You get a red, white, and blue Medicare card, looks similar to this, well, it looks just like this. And you use that like your insurance card when you go to the doctor or the hospital and receive medical benefits. There are 2 additional parts of Medicare. There's Medicare Part C, which is called a Medicare Advantage plan, and the Medicare Part D, that's a prescription benefit with Medicare. Medicare Part C and Part D are administered by private health insurance companies. The retiree plan that we're going to present to you today through Utah State University is a Medicare Part C or Medicare Advantage plan. When you choose a Medicare Advantage plan, you're basically choosing to have a private health insurance company like Regents administer Medicare for the federal government. You no longer use that red, white, and blue Medicare card that's on the top of the screen. You get a new card from Regents that you use at the doctor, the hospital, and the pharmacy. Because we're administering Medicare for the federal government, they actually subsidize us every month for administering those benefits. And it looks like Tina has been able to join. Tina, do you want to take over the presentation?
Yes, I truly apologize for my computer error issues. But yes, I would love to take over. So thank you so much.
Sure, I'll just control the presentation so you can say next screen or I'll try and guess.
Okay, wonderful. So have you taken over this whole screen already, or should I just start over here? Start with the beginning of this?
Can you see the presentation? Do you want to just continue on with what's on the screen?
Yes. So, okay, so with original Medicare, you have Medicare Part A, which is for your hospital benefits. That's your inpatient hospital stays and skilled nursing facilities. Part B for your doctor visits and outpatient visits. So everything you do on an outpatient basis, these 2 are administered by the U.S. federal government. Now, there's also something you may have heard called Part C, known as Medicare Advantage plans, and Part D, prescription drug plans. These 2 are actually not handled by Original Medicare. These are handled by private insurance companies. So kind of a different animal. Go ahead. So let's take a look at how Original Medicare works and what it costs for you. So if you go into the hospital, it's going to be covered under Medicare Part A, and that's covered for inpatient care, hospitalization, skilled nursing facilities, hospice care, so if you're terminally ill, and some of your home health care services. Now, the cost in 2022, since we're so close, now let's take a step back and just assume that you have original Medicare only. If you were to go in the hospital and spend just days 1 through 60, you would be responsible to pay a Part A deductible of $1,556. And then Medicare says, all right, we'll pick up the rest. But if you're still in the hospital, days 61 through 90, then you have a daily copay of $389. Well, now I'm still in the hospital, days 91 through 150, and I know what you're thinking, nobody stays in that long, but if you're in the ICU, now your copay is now doubled to $778. Now, maybe you can't be released and go home, so you need to go to a skilled nursing facility for rehabilitative care. The first 20 days are going to be covered at 100%, but days 21 through 100, the daily copay is now $194.50. Now, Medicare Part B does have a monthly premium that's typically drawn out of Social Security. Now, the monthly premium for 2022, right now, most people are paying $148.50 a month, and it has been announced that it's going to jump up to $170.10 a month. On top of what you're going to be, your cost of living increase. So, the Part B is going to help cover your preventive services, doctor visits, outpatient surgery, labs and x-rays, and then your diabetic testing supplies, so lancets, test strips, glucometer strips, durable medical equipment such as CPAP machines, oxygen, wheelchairs. And then there are Part B drugs such as chemotherapy medications that are actually covered under the medical side and not at the pharmacy. Now, how much are you going to pay for your Part B? When you're going in to the doctors, luckily it's not a per visit deductible. The annual deductible is $203 for 2022, which is a slight jump from this year of $203. Medicare is going to pick up the larger portion of 80%, leaving you the 20% balance, where there's no limit. The sky is the limit. So this is just assuming, again, remember, you have Medicare only. Now, here's an example of some benefits that are not covered by original Medicare that maybe you're used to having as part of your group health plan, such as prescription drugs, long-term care, custodial care, your activities of daily living. That is something you typically purchase through a life insurance agent. A routine dental and dentures, not a benefit. Your vision exam, if it's routine, and your eyewear, routine hearing exam and hearing aids, most of your alternative care, such as chiropractic or acupuncture, and your fitness memberships and care outside of the United States is not a benefit of original Medicare, although they do cover quite a bit. So maybe you need a stent or a joint replacement, open heart surgery. So there are some great value to Medicare. So let's look at when is the best time to enroll in a Medicare. And there are several different enrollment periods, so don't worry if you missed the initial enrollment period. Here's the first one. Now, your initial enrollment period is when you are enrolling into Medicare Parts A and B is your 7-month window that starts 3 months before your 65th birthday, and it includes the month of your birthday and ends 3 months after. But it's going to start the first day of the month. So for example, my birthday is November 17th. So if my birthday, if I'm applying September, October, no, I'm sorry, August, September, October, then my effective date is going to be November 1st. And then if I still waited, I can still apply 3 months after. So enrolling for Medicare is through Social Security. So I'm going to enroll either online through SSA, Social Security Administration.gov. But if I'm already receiving Social Security income prior to age 65, then I'm automatically enrolled in a Medicare. But if you're not, then like most people, then you need to proactively enroll. And so you can either do that through the website, which is the easiest. Right now, people are unable to go into Social Security. So otherwise, they can call and schedule out an appointment they'll schedule out a month in advance. But otherwise, I, as an insurance agent, can help you do that. And my contact information will be at the end. And then, so if you sorry, if you enroll in original Medicare A and B, you can add in a prescription Part D drug plan, or you can enroll in a Medicare Advantage plan that includes your medical and your drug coverage that we're going to talk a lot about today. So your next enrollment period, let's just say you don't enroll in a Part B when you're first eligible. You're hearing everybody talk about there's this 10% penalty for delaying Medicare Part B. Well, you may avoid a penalty if you or your spouse is actively working and you are covered by your employer group health plan. So that's the number one key. If you or your spouse is actively working, so not retiree coverage, one of you is actively working and you're both covered by the employer health coverage, then you're going to delay your Medicare Part B and you're not going to be assessed any Part B penalties. Great. So by the time that you're ready to retire and come off that group health plan, then that is your special enrollment period when you're beyond age 65. Great. I have this 8-month enrollment period that begins the month after my employment ends to sign up for Part B. Late enrollment penalty. But most people are not going to wait after their coverage ends. You want to do everything prior to. So you can call me or you can start the process roughly 3 months in advance. Medicare does not allow you to apply for Medicare any earlier than 3 months prior to your requested effective date. And at that time, I would help you, or you're going to go to HR, the Human Resources at Utah State University, and they're going to provide a employment verification form that you need to either mail to Social Security or upload to the Social Security website when you apply for Medicare Part B. And that's showing, yes, I've been actively working. This is my special enrollment period. If for any reason you missed both windows of opportunities, you've missed your special enrollment period, you've missed your initial enrollment period, now you've got to wait for your general enrollment period. So that's January 1st to the end of March, but you're not going to be enrolled until July 1st. And you will be assessed penalties. So that 10% is for every 12 months that you delayed Medicare Part B when you didn't have any coverage. Okay. So let's explore your Medicare options. There is light at the end of the tunnel, I promise you. Let's look at two different ways on how to get your additional coverage. So you're ready to retire. Now I'm going to be losing my group health plan. I can choose one of two paths, not both. I can enroll in original Medicare Part A for my hospital benefits. So A is not going to cost me anything. Part B, I have my monthly premium. So starting at $170.50 a month for 2022. I'm going to pay that to Social Security. Well, we talked about all these gaps, these Medicare deductibles, these 20% co-insurance, all of these co-pays. Well, I don't want to pay that. Well, what's going to fill in those gaps? Well, I can work with you and you can buy a Medigap policy through a private insurance company as your secondary coverage to fill in those gaps. So there are plans identified like alphabet soup, plans A through N, not to confuse you as Medicare's parts A, B, C, and D. But if you're going to buy a Medigap plan, they are identified by letters. So great. If I buy a Medigap plan, then I'm going to choose the plan that's going to best fit me. And then that's for medical only. Well, what about prescriptions? I need a standalone Part D prescription drug plan. And then if I want dental or vision, those are also standalone. So everything's a la carte. Or I could, instead of having primary and secondary, I could choose my Medicare to all be administered through a private insurance company. Maybe it's Regence, Blue Cross Blue Shield, or any insurance company that has a federal contract with Medicare. Great, I'm going to choose a Part C Medicare Advantage plan that combines my Medicare Parts A, B, so hospital and medical. It's going to administer my Part D prescription drug benefits, and it's going to offer me extra benefits such as dental, vision, gym memberships, all under one umbrella, one customer service, one ID card, but it does come with some out-of-pocket expenses. Well, if my premium runs, it could be $0. It could cost a little bit more because it has this comprehensive dental, so it costs a little bit extra. But I'm going to pay a little bit here and there for doctor visits or hospital visits. But great, instead of paying a higher monthly premium and use it or not, it works a little bit different. So you pick one way, one path or the other. You cannot have both the Medigap supplemental plan and the Advantage. And it's not that there's pros and cons to both plans. It's not that one is better than the other. It's what is the better plan for you. And you must pay your Medicare Part B premium no matter which plan, which type of plan you go with. So you can't run away from that. Now, here's what's so exciting is if you go with the Regents group sponsored plan with the Utah State University, and it's this Medicare Advantage Part C, this plan is going to replace your original Medicare and be your Medicare administrator. It's going to be the primary payer of your Parts A and B. It's going to include your extra benefits that I discussed earlier, your dental. It's going to give you vision, hearing aid coverage. What's so nice about being part of a retiree plan is that it's portable. You can live anywhere in the United States and still enroll in the plan. Whether you live here in Utah or you live in Washington or you live in Hawaii, you're here in the United States, you can enroll in this plan because Utah State University is sponsoring this great policy for you. Whether you're going to retire in the future, you're a past retiree, you can enroll in this plan, you or your spouse or your Medicare dependents, and it includes your Part D prescription drug plan that Medicare's been talking about. The provider network is a PPO. It's a preferred provider organization. Gives you a nationwide network, giving you access to in-network and out-of-network access, where here in Utah, here's the great news. You're getting the best of both worlds. It's going to cover every single hospital in Utah as in-network. So you have Intermountain Healthcare, which is your IHC facilities, University of Utah, your Mountain Star, Steward, everybody is in network. And then roughly 96% of the providers in Utah are also in network. That's huge. And when you're traveling, there's 47 states that have in network sharing with all of these providers as part of the Blues providers. So if you go to California, for example, and you want to have the best back doctor in California, and that provider has a contract with the local Blue Cross or Blue Shield, then great, your claims are going to be paid just like your home. And if you have a provider that's not in network in your area of where you live, that's okay. It's going to be paid in network because you're part of this retiree plan. You're going to get one member ID card for all services of medical, dental, vision, hearing aids, everything all built into one ID card, even at the pharmacy. And that's called Medicare Advantage Part C. You can enroll any time of the year because it's a continuous open enrollment. And here's what's so exciting. You have a guaranteed issue onto the Medicare supplement, the Medigap policy, that first path of the option we're talking about. If you want to jump from the Medicare Advantage to the Medigap or back and forth, you can do that if you decide to make any changes in the future. So it's not like, oh, is this the right decision for me? Because I can make a change for the following month if something was to happen. You can give me a call. I can walk you through it, fill out an application, and I get you on to the new plan the following month. And then a standalone drug plan that opens up a special enrollment period. All because it looks like you're coming off of a retiree plan, like you're retiring again. So that is not common like the individual market. So your neighbors may say, I didn't hear that from my broker. This is unique for you as a retiree on a group sponsored Medicare Advantage plan. So keep that in mind. Very exciting. Okay, let's move forward.
Sorry, I'm having a trouble. Oh, sorry. There we go.
You're okay. Perfect. All right, so let's dive into the benefits of Utah State University's 2022 Regents Group Medicare Retiree Plans. There are two different options. The first one is called the Regents Med Advantage plus RX Primary Plan, also a PPO network. These are both sponsored by Regents Blue Cross Blue Shield. First one has a 0 monthly premium. Also, the second option, Regents Med Advantage plus RX Classic. This is with the comprehensive dental for dental work with the PPO network at $45 a month. This is per person that wants to enroll. So let's dive in. All right, so the eligibility rules are this is available to Medicare eligible retirees, spouses, and dependents of the plan. So if you've had an employer relationship, you've worked for Utah State University in the past, or you're working for them now and you're looking at retiring, you are able to enroll into this plan one day, you or your spouse, and then you must be enrolled into both Medicare Parts A and B. And as long as you live within the United States. And then here is the map with all 47 states that have in-network providers. You can also go to Hawaii, you can go to Puerto Rico. And in the case of an emergency, don't ever worry where you are. You are always covered in-network worldwide. And if you would like to find an in-network provider prior to visiting, then you can go to regents.com/Medicare/providers. Since you don't have a Medicare ID or a Regents Blue Cross Blue Shield ID card today on this program, if you go into this website, it's going to ask you for an alpha prefix, which you for now can use Z as in zebra, V as in Victor, U as in Utah. ZVU. And that suitcase in the upper right hand corner shows that you can travel. It's a PPO network, which will be listed on your member ID card. So great access and no referrals required. Even better. Looking at the two plans side by side, the primary plan, 0 monthly premium on the left, classic with the comprehensive dental on the right at $45 a month. They both have 0 medical deductibles. The out-of-pocket maximum, where it shows a higher amount, this just means this is your safety net. This does not guarantee that you're going to pay this amount. This just means that in the worst case scenario, if you were to pay, let's say, 20% of chemotherapy, or you were to go to the hospital multiple times throughout the year, as we go through the benefits, anything that you pay for medical out of your pocket is going to apply towards this out-of-pocket maximum, your safety net. This is good. So on the primary plan in network, you have an out-of-pocket maximum of $5,900 per calendar year. Starts over every January, ending on December 31st. So a little bit different, does not run on a contract year. And then if you go out of network, which is going to be pretty rare for you guys on this retiree plan, it is a combined with in-network of $10,000. But I like to focus on in-network benefits of $5,900 and then on the classic of $5,500 in-network. If you happen to go out of the network because you just love this particular doctor and there's plenty of in-network providers around you, and if you choose him, then it's a 30% out of pocket for you on both policies. If you go in to see your primary care physician, you either pay $5 copays per visit on the primary or 0 on the classic. And then going to see a specialist with no referrals, it's a $45 copay or $40. And then if you have a virtual doctor visit through telehealth, so you can see doctors through your phone, visit them through your computers, PCs, laptops, it's either $5 or 0. And move forward to the next slide.
Is it not moving forward?
No.
I moved it forward, but it,
Oh, there we go.
okay. Sorry, there's a delay.
Okay. Nope, you're just fine. Okay, so looking at the outpatient surgery benefit, depending on your place of service, your copay is going to be less if you go to an ambulatory surgical center. So these are freestanding clinics, surgery centers outside of a hospital. They're not associated with the hospital. And on the primary plan, if you go to the ambulatory surgical center, you're going to pay a fixed flat copay of $300 or $350 in a hospital setting. So that means that if I go in for the outpatient surgery, everything performed that day, the facility, the surgeon, the anesthesiologist, any labs or x-rays that are performed are all going to be covered under this one single copay. Very nice. On the classic plan, you either pay $225 at the ambulatory surgical center or $300 at the hospital. Same thing, one single copay for the entire day. Now, if you go to the hospital inpatient overnight on the primary plan, each day for days 1 through 4, your copay is $400. Now, if you're in the hospital 2 weeks, the most you can pay is $1,600 for the first 4 days, because at days 5 and beyond, it's going to drop to a 0 copay. So that's it's comforting. And then on the classic plan, it's $350 per day for days 1 through 4. And at days 5 and beyond, it drops to 0. So very nice to know that if you have a $100,000 claim, you cannot even reach that amount. Or you'll notice that those amounts will apply towards that maximum out of pocket, but just made a slight dent into that. Moving forward. If you go for worldwide coverage to the urgent care, Your copay is $45 or $40. Emergency room on both plans have a $90 copay. And if you are admitted into the hospital within 48 hours of the emergency room, the $90 is waived because now it is going back to the inpatient care. Now, if you're riding in the ambulance by land or by air, to think $15,000 minimum by air, you're only going to pay a $275 copay. Very nice. Now, chiropractic benefits are covered under this plan, which is very nice, which is going to cover the treatment that the chiropractor needs to provide, not just what Medicare covers, which is spinal manipulation. On the primary plan, you're allowed 18 visits per year, and on the classic plan, you're getting an additional amount, so you get 24 visits per year, and per visit, a $20 copays. On both plans, you get a hearing aid benefit. You want to make sure that you are going through True Hearing. True Hearing is a network of audiologists that work together through an insurance network. You want to call True Hearing. You'll receive this information in the mail as part of your welcome packet. You call a specific phone number. You're going to let them know based on your ID number. They know where your zip code. They're going to find a audiologist near you, schedule the appointment. You go in, get your hearing exam with a zero copay. They're going to find the hearing aid that's right for you. And if you either pay a $699 copay per aid or $999 copay. Depending on what hearing aids you need, these can run to between $6,000 per hearing aid. Hearing aids, these are very expensive, they're high quality, and it's nice to know that you're going to pay a lot less for great quality. They're Bluetooth. You can adjust these with your phone, and just great benefit. Also, you get vision benefits that are included using VSP. And VSP is another insurance network, a vendor that Regence Blue Cross Blue Shield works with. Many different eye doctors that are working together to provide the greatest discount, where you're getting a eye exam with a zero copay on both plans. And then if you're going in for your frames or contacts, you're getting a $100 allowance every year. And then the lenses, for standard lenses, you have a zero copay. It's paid at 100% for your single vision, lined bifocals, lined trifocals, or lenticular lenses. If you're getting progressive, you're getting a substantial discount. But overall, I look at that as roughly a $250 value. Moving into the dental benefits, you get a great benefit whether you're on the primary plan or the classic. They both include the preventive dental. So cleanings, x-rays, or exams are covered twice a year at 100% with no copay. Here in Utah, there's over 4,000 dentists, so you can find them all around. And then if you need a little bit more high level of comprehensive dental for dental work, it is only covered on the classic plan, where if you need a filling, a crown, bridges, dental implants, endo and periodontics, including oral surgery, then that is only part of the classic plan at $45 a month. This plan will pay on top, so above and beyond the preventive dental, it will pay 50% for dental work, up to $1,000 out of the insurance pocket every year per person. So if Blue Cross receives a claim for $2,000, the insurance will cut a check for $1,000 right out of the gates, no waiting period. And then if you've already maximized that amount, you still get your preventive dental twice a year. So to me, that's a $1,500 value. So we've talked a lot about medical. You get your vision, your hearing aid benefits, dental, whether it's preventive or comprehensive. But really important is people need their prescription drugs covered. So whether you're taking no drugs or they're just generics, but many people are taking name brand drugs as well. So it's nice to know that Regence Blue Cross Blue Shield has a large pharmacy network, national network. They're using preferred network pharmacies to provide you the lowest cost. And these preferred pharmacies include Kroger, known as Fred Meyers and Smith's, Rite Aid, Walgreens, Albertsons, Costco, Walmart, and a lot of these independent pharmacy groups. They're known as Elevate and Health Mart Atlas and Aerie. There are mail order programs through Express Scripts, PPS, that's Postal Prescription Services, and Walgreens mail order program called Alliance. Now, members are going to pay 2 times the monthly copay for a 3-month supply of generic drugs. Generics are known as Tier 1 and Tier 2. If you need a preferred brand name drug, that's known as Tier 3. And you can pay 2.5 times the monthly copay for a 3-month supply. There are non-network pharmacies that are acceptable, but only in the case of an emergency. And Part D prescription drugs are only covered within the United States. So I'm sorry, you cannot buy them through Canada or Mexico. Now, if you need to find prescriptions that are how they're covered under the formulary, what tier level, these slides are going to be emailed to you. But you're going to go to, this is the Regence Med Advantage Plus RX, the Medicare Retiree Group Plan. The 2022 online link is regence.com/go/MRG, that stands for Medicare Retiree Group, /PPO/2022 formulary PDF. Very long, but we're going to email you these slides so you can copy and paste that. Okay. Now diving into the benefits and looking at the plans that are already included in that primary plan at a 0 monthly premium and the classic plan at $45 a month, this is what you get. On the primary plan, there's a 0 annual deductible for tiers 1 and 2 on the generic drugs. And if you're taking any name brand medications that fall under tiers 3, 4, and 5, you must satisfy the $200 annual deductible before you start paying any of these copays that are listed below. Now, on the 30-day supplies, you're going to save money, of course, by getting 90-day supplies, but what's listed here is talking about 30-day supplies. If you get a tier 1 preferred generic, you pay $0 for either the 30-day or you can get 90 days at 0. And same thing for mail order. If you decide to get a mail order for tier 1 and 2, then you still can pay 0 copays. So that's convenient. If you purchase a tier 2 drug, that's a non-preferred generic, more of those standard generics. You can either pay $13 of a tier 1 or 2 times the copay, $26 with a preferred pharmacy for 90 days. And then tier 3, preferred brand. So remember, you have to meet that $200 first for the whole year before you pay $40 for 3-month supplies, or it's going to be 2.5 times the copay. All right, so then you've got the tier 4 at 40% after the deductible, and then tier 5 at 29%, specialty medications. So the goal here is trying to get alternatives to these higher tier levels, asking your doctors for generics when you can. And if you're getting any tier 3 or 4 insulin drugs, great news is they're only $35. No matter if it's a preferred or standard retail pharmacy, the deductible is waived. So that's fantastic news for those of you that are diabetics and need insulin. On the classic, let's jump back. On the classic plan, the deductible only applies to tiers 3, 4, and 5 at $150, and then the copays are very similar. All right, jumping over to how these drug plans work. There's the initial coverage limit that we just discussed. In the initial coverage, you're just paying your copays, the deductible. But if your retail cost of drugs reaches in 2022, goes over the threshold of $4,430, it's going to push you into the coverage gap known as the dreaded donut hole, where now you, as the member, pay 25% of all your drugs. So, how do you get out? Well, between you and the drug manufacturer, if you keep paying for these medications and they now have gone over the threshold of $7,050, it pushes you into catastrophic. And the catastrophic stage, you either pay a much smaller copay or 5%, whichever is greater. So this is standard, nothing that's only, it's not designed by Regents, Blue Cross Blue Shield, it is designed by the government. Moving forward. All right, there's a lot of great plan features that you're getting once you enroll in this plan. Is you get a free gym membership that's included through Silver&Fit. Silver&Fit is providing you no cost access to over 16,000 standard fitness centers nationwide and some of the select YMCAs, not here in Utah. But you get one free home fitness kit per year that includes a Fitbit or a Garmin activity tracker that you wear on your wrist. Or maybe you want one of the strength or yoga, aquatic, or Pilates at-home kits. So these are really nice that you're not going to pay for, but you also get to go to the gym or your local rec center. Very nice. And you can choose more than one fitness facility, or maybe you prefer to work out at home using these workout videos that are Facebook Live, YouTube. Very nice. We can mail you videos as well. Again, that's through Silver&Fit. Jumping forward, something new for 2022 is Regents Blue Cross Blue Shield is providing you some bathroom safety devices to prevent or basically reducing a fall risk. So you're getting a $100 annual allowance for select bathroom safety items that are not covered by original Medicare. These are things like shower or bathtub grab bars or benches, commode toilet rails, or elevated toilet seats, a tub stool, transfer bench, or chair. And these covered items can be purchased from any supplier, a network of DME, durable medical equipment providers. They can build the plan, or customer service will assist with the reimbursement process. Or if you end up submitting, if you pay at Lowe's or Home Depot, for example, you buy it at the store, then yeah, someone at customer service can help you with getting reimbursed. No prior authorization or referrals are required. And then installation and in-home assessments, those are not covered. You also have a great benefit of the virtual companionship service. Maybe you don't need it now, but maybe you need it in the future, is a great benefit to keep in mind. Members who meet eligibility criteria are going to receive virtual companionship through the phone or video conferencing. You get technology lessons, grocery shopping, and prescription delivery. So if you think, gosh, maybe I don't feel good, I'm sick, or I've been released from the hospital, these services would really come in handy to have somebody be able to provide these services, especially dropping off medications and groceries. And the coverage includes 4 hours per month with the option to purchase additional hours. To qualify, members must have at least one chronic condition and qualify through a benchmark assessment of baseline loneliness, social isolation, and self-reported unhealthy days per month. This is offered through Papa Pals, and they're going to verify eligibility and enroll members in this program. So there's a joinpapa.com/regents website, or you're going to receive a flyer on where to call. There's also a great meal delivery service through Mom's Mills delivery program. This has been great. This has been new in 2021 and will transfer over for next year. It is available for following an inpatient or skilled nursing or rehab facility stay or nutritional support for managing a chronic condition. Now, these meals are delivered directly to the member's home. You get 2 meals per day for up to 28 days or up to 56 days per episode for chronic conditions. It's a high quality, health condition based refrigerated meals. These are designed by registered dietitians and chefs to be nutritious and good tasting. Prior authorization and participation in the care management program is required, and additional chronic condition eligibility requirements do apply. I really think this program, the Personal Emergency Response System, is great. It's going to help people prevent falls or help prevent them from going into the hospital. This system, you get a free device and monthly monitoring program paid for at 100% by Regents Blue Cross Blue Shield. This coverage is offered through Lively Mobile Plus Medical Alert Service. You get the device and the monthly monitoring at no charge to you. So this is something you wear around the neck, like I've fallen and I can't get up, a lot of people will say, or they recognize from the commercials. You get 24-hour emergency service available to you at no cost. It includes the GPS location services that work anywhere in the United States. You get two-way voice communication. It can be used as often as needed with no worry about running out of minutes. And the devices are water resistant. Fall detection is available upon request. Device and monitoring provided by Great Call. And prior authorization and eligibility criteria is not required. So if you think you need it or a spouse needs it, this is something that you guys can call, get all set up. Or you can call me and I'd be more than happy to help you. So I do want to thank all of you for your time today. I truly appreciate you learning about this program, all about the basics of Medicare and what Utah State University is offering to you. And my name is Tina Davis, and I am your Utah State University Medicare Specialist.